Hi, my name is Chandler Berg, and I am talking about congenital hearing loss. What is congenital hearing loss? Well, it means that when you're born with a hearing loss. Some causes of congenital hearing loss can include infections, premature birth, low birth weight, birth injuries, drug and alcohol use while pregnant, and/or anoxia, which means that the baby did not receive enough oxygen. Another main cause of congenital hearing loss is genetics. This means that one or both parents may carry the gene even without knowing it and pass it on to their baby. For example, a dad or a mom or both of them could carry the gene. They might not have any kind of hearing loss at all, but then when they have their baby, that baby could have a hearing loss. Some babies are born with a genetic syndrome that may include hearing loss as a symptom. And so some examples of genetic syndromes include Down syndrome, Usher syndrome, Treacher-Collins syndrome, and Crozon syndrome. So some signs and symptoms of a hearing loss. Muffling sound when someone is speaking, difficulty understanding words, especially in a crowded area with a lot of background noise, the difficulty of hearing consonants, having to frequently ask people to slow down, repeat themselves, or speak more clearly, needing to turn up the volume on the TV or radio, withdrawing from conversations, and possibly avoiding social situations. So, types of hearing loss, as we have learned throughout the semester, are conductive hearing loss, sensory neural hearing loss, and mixed hearing loss. And just as a refresher, conductive hearing loss involves the outer to middle ear where the air conduction is affected. Sensory neural hearing loss involves the inner ear where air conduction and bone conduction correspond with one another. That's where the AC equals BC. And mixed hearing loss is a combination of both conductive and sensory neural. And this means that the AC and the BC are both affected, but what differentiates mixed from sensory neural hearing loss is that mixed hearing loss is not to the same extent as sensory neural. And because congenital hearing loss occurs at birth, depending on what part of the ear was affected, a person could have either three types of hearing loss. There is not one type of hearing loss that takes prevalence over the others in congenital hearing loss. And so, for example, my mom is a 53-year-old female. She was just diagnosed with mild to low frequency sensory neural hearing loss in both ears. The doctor told her that she is most likely was born with congenital hearing loss, and that because she grew up with it, she became accustomed to it for most of her whole life. But now, as she's gotten older, it is starting to affect her in her daily life. So what do you do if you think you might have hearing loss? Well, you'll go to the doctor and you'll visit an audiologist. The audiologist will perform what is known as an audiometry evaluation. This is used to evaluate the ability for someone to hear different sounds, pitches, or frequencies. Now below is my mom's audiometry evaluations in her right and her left ear. All right, pop quiz. Do you remember what the colors and symbols mean on an audiometry evaluation? Well, if we flash back a few months ago, we learned that red circles means the right ear and that the blue X's mean the left ear. And the little arrows signify bone conduction. Now, looking at both evaluations, can you guess what specific hearing loss my mom has and what is the cause for this kind of hearing loss? Well, my mom has moderate bilateral low to mid frequency sensory neural hearing loss, and it is suspected that she has congenital hearing loss. The doctors cannot say they are 100% sure that this is what she has, but they're almost certain that she was born with it. There's another exam my mom could have partaken in that would have told her if she was born with it, but she's 53, she knows she has a hearing loss, and she doesn't need to know anything else. But my mom does have kind of a rare sensory neural hearing loss, and this is called a cookie bite hearing loss. So when someone suffers from a cookie bite hearing loss, they usually have difficulty hearing mid-frequencies. The low and the high frequencies are usually unaffected and they usually don't have any problems with those frequencies. And the number one cause for a cookie butt hearing loss is it's hereditary. And a lot of times this hearing loss is discovered by people between the age of 30 and 40. And this is just an example of what a true cookie butt hearing loss really looks like. And if we go back to my mom's, we can see that it's not a true cookie butt hearing loss, but it is near perfect. And we see that she really struggles with the low to mid frequencies. The mid obviously more than low, but her high frequencies are near perfect or normal. And I would like to point out that her right ear is slightly worse than her left ear. As you can see in her right ear, it dips down much more in these low mid frequencies where it kind of goes up just a little bit more in her left ear. But she does slightly struggle with her high frequencies in her left ear compared to the right ear. Tympanograms are another evaluation that will be used when you visit the audiologist, and they are used to measure the middle ear function. And it specifically shows how the eardrum moves in response to the air pressure within the ear canal. So my mom's tympanograms above, her middle ear function is normal. And then below is just another example of a normal tympanogram. Case history. When you go to the audiologist, they will have you fill out a case history form. And this helps the audiologist get an idea of your health and hearing history, along with how it has been impacting your life. So this is an example of a case history form I found online that I had my mom fill out. There's 2 questions that I would really like to point out, and that is number 3, if you have a hearing loss, how long have you noticed this? My mom recalls that when she was about 8 to 10 years old, she told her parents that she felt like she couldn't hear very well. And that's pretty significant because she's 8 to 10 years old. She's pretty young, and she notices that she might not hear very well. But yet, when she was 5 to 6, she really didn't know, and that's because she probably wasn't very aware when she was that young. And then another question that I want to point out is question 10. Is there a case history of hearing loss in your immediate family? She says yes, but she says that my grandpa, because he had his eardrums ruptured when he was in the war. Now that is irrelevant in this case because something caused his eardrums to be ruptured. It was not genetic. There's a chance that maybe he did have the gene or he did have hearing loss before he ruptured it, but he died when he was 50, so we don't really have that information and we could not use that information for this. And then another thing that I want to point out is for the comments and questions, my mom states that she just got hearing aids and she doesn't know if it is really working for her. She feels she doesn't notice a difference and that she's just worried that this is a lot of money that she's spending for something that's not working. But she also notes that she has not been very consistent with that. And that is extremely important. When you get hearing aids or a cochlear implant, you need to be consistent because when you have a hearing loss or you are deaf or extremely hard of hearing and you get these hearing aids or cochlear implants, your brain has never registered these noises before, and now all of a sudden it has to, and it doesn't really know what's going on. So it takes consistency for your brain to start to comprehend what it's hearing because it's not used to those noises. And this is a snippet from my mom's actual audiologist and her evaluation form that was filled out. And there's a few things I would like to point out. So if we look at this last sentence, she denied autophagia, auroral fullness, tetanus, autourea, recent ear infections, and ear surgeries. So that's significant because autophagia is an earache. Auroral fullness is when there's pressure that cannot be relieved and results in that feeling of an ear fullness, ear pressure. Tetanus, we've talked about before, perception of ringing or noise within the ear, and autourea is ear drainage. These are important because this just goes to show that it is looking more and more like a congenital hearing loss because she hasn't had any of these symptoms or infections that has led to a hearing loss, so it just kind of rules out process of elimination that it's looking more and more like a congenital hearing loss. Now, if we go to objective and we look at otoscopy, that is a procedure to examine the structures of the ear. And then we have tympanometry, which is the tympanograms, the use or the measurement of how well the middle ear is functioning. And then we also have audiological testing. That includes the word recognition test. This is also known as a speech discrimination test. And what this does is it's used to assess a person's ability to understand speech from background noise. And the word recognition test is used to predict the usefulness of hearing aids. So if we look at this small little diagram of my mom's word recognition test, she scored an 88% in her right ear and a 96% in her left ear at 70 decibels. What this means is that normal speech is around 50 decibels, but they heightened it to 70 decibels to try and get the most clarity. So her ear produced about 88% clarity, and her left ear has about 96% clarity at 70 decibels. So even with hearing aids, she still might have some problems, and might not be able to hear with 100% clarity. So some treatments. Now, there is a universal newborn screening test that screens newborn babies for hearing loss prior to 1 month of age. This is significant because when my mom was born, they did not have these universal screening tests. So there is a chance that if she had been screened within 1 month of birth, that they could have found that she had a hearing loss, and they could have taken procedures to maybe slow down or help the hearing loss that she had. But a problem is, too, that there's a chance that it might not have registered that her mid to low frequencies were not normal. So, if an infant does not pass the screening exam, they will be recommended to have an audiological evaluation by 3 months. Again, these exams are not 100% perfect, and these exams might not specifically address all frequencies. So, there are 3 main treatments for hearing loss: hearing aids, cochlear implants, and an auditory brainstem implant. So, what is the difference between hearing aids and cochlear implants? They both work for people with sensory neural hearing loss, but hearing aids are usually for those who have a hearing loss, and cochlear implants are used for those who are deaf or extremely hard of hearing. Auditory brainstem implants are used for when hearing aids and cochlear implants do not benefit a person with hearing loss, and this would be, for example, if they don't have a cochlea. Prevalence. So, 6,500 U.S. infants born in 2017 were identified with permanent hearing loss. And genetics contributes to about 50 to 60% of hearing loss among children. And that is a pretty significant amount, and it just kind of goes to show that there is a very good chance that my mom was probably born with congenital hearing loss, especially that she has or is very close to having a cookie bite hearing loss, with the main cause being hereditary. These are my resources, and thank you for listening to my presentation.